Hi, my name is Candace Middlesdorf, and I'm going to talk to you today about the autonomic nervous system and the different medications that go along with the autonomic nervous system. Before class, you should give your students some chapters to read in a pharmacology book, and that's just going to help them to review autonomic nervous system medications and help them be further prepared for class so that further discussion can occur and they can interact with things such as a case study, role play, or identifying items on a chart. You can also give them a link to a YouTube video just to further look at the autonomic nervous system and its different components and parts and how they work. And that'll just further prepare them for looking at the different medications and the different reactions that are going to occur for those medications. You also want to give them a quiz prior to class. Now this can be given in Canvas. It's just a short quiz, and it's just to help evaluate the student to make sure that they really did do the pre-work in class, and just see maybe there's some points that you should focus on if it's a question that all of the students seem to be missing. Once the students arrive to class, you need to make sure that prior to lecture, you're giving the students about 15 minutes just to talk about the different points that they reviewed at home. And they can also bring up muddiest points. So something that they really had a hard time understanding, that can give you an opportunity to really focus on that in class and further clarify what they're having trouble understanding. Now I'm going to have a PowerPoint available for class. It's going to outline everything that's going to be talked about during class, and you can also use different charts and models such as the ones to the side of me just to further support the class and help them to be more interactive. The first thing that you want to review is the autonomic nervous system and how it's broken down. So you want to talk about the sympathetic nervous system and the parasympathetic nervous system, and what kind of responses occur with each of these nervous systems. For example, the sympathetic nervous system is going to cause that fight or flight response, where the parasympathetic nervous system is going to be your rest and digest nervous system. You also want to talk about the mechanisms of action. So what's going to happen that's going to cause a drug to have a certain effect. So you look at the neurotransmitters and the receptor sites. The receptor sites are going to be your lock, and the neurotransmitters are going to be the key. How those interact, whether it's the lock being blocked or they fit perfectly, is going to affect the type of reaction that's going to occur. You also can put the class into different groups and let them use a chart such as this one to label the different responses that might occur in the sympathetic nervous system versus parasympathetic nervous system. Just a few examples, we can look at the pupils, for example. During the sympathetic response, your pupils are going to be dilated. If you're given a medication that causes a sympathetic response, their pupils may be dilated. The opposite would be your parasympathetic nervous system, where your pupils are going to be constricted. You're in that rest and digest, you're not worried about seeing everything, so they're going to be more constricted. Another example we can look at is the heart rate. So for your sympathetic nervous system, your heart rate's going to be faster. You're in that fight or flight mode, your heart's beating away, trying to get you out of that situation, or from the drug that you have given. The opposite would be the parasympathetic response, where your heart rate would be slower. Again, you're in that rest and digest mode. One final example, we can look at the bladder as far as voiding. So your sympathetic nervous system, your bladder is going to inhibit voiding. You're in that fight or flight mode, you're not worried about voiding. Your parasympathetic is going to promote voiding. You're more relaxed, so you're going to be more likely to void. One final example, just because a lot of medications affect this, is looking at the vasculature. So your sympathetic nervous system, your vessels would be more constricted, because you're clamped down, you're in that fight or flight mode. All the blood's going to your vital organs, where your parasympathetic nervous system is going to be, your vessels would be more dilated because you're in that rest mode. So once you've gotten the class to identify different parts of the nervous systems, it'll help them to further understand a parasympathetic and a sympathetic response. You also can discuss, even before you look at medications, discuss different definitions with the class. And this will help them further understand the different categories of medications and help them to understand the type of drug reaction that will occur. One definition you could help them understand is an adrenergic response, which is going to occur with your sympathetic nervous system. Your adrenergic response would occur, your neurotransmitter for that system is going to be adrenaline. So you think about adrenaline, that's a natural body response for that fight or flight mode. The receptor sites would probably be broken into an alpha or a beta receptor site. The opposite would be your parasympathetic nervous system, which is going to cause a cholinergic response. The cholinergic response, you think of your neurotransmitter being acetylcholine, and your receptor sites are going to be broken into the muscarinic and nicotinic. Two more definitions that they should understand is agonist versus antagonist. So agonists are going to be pro or for, whereas antagonists are going to be opposed or against. Then you can place the class into 4 groups. You want them to look at the 4 main categories of the autonomic nervous system medications, and they need to show some examples of drugs in those categories and talk about, is it going to be a sympathetic reaction or response or a parasympathetic reaction or response. So the 4 main categories are going to be your cholinergic agonist, your cholinergic antagonist, your adrenergic agonist, and your adrenergic antagonist. So just 2 examples, if we're looking at the cholinergic antagonist, so we're looking at the cholinergic, which is your parasympathetic response, but an antagonist would be against. So looking at atropine, atropine is going to cause your pupils to dilate. Now that's not going to happen as a parasympathetic response, but this is an antagonist, so it's against that parasympathetic response. Another example would be under the adrenergic antagonist, which would be like giving the patient Coreg or low pressor, and we're looking at the patient's heart rate. So that's going to be a beta response, a beta adrenergic antagonist, but it's going to be against that adrenergic response, which would be against the sympathetic. So your sympathetic is going to cause your heart rate to be faster, but Coreg is going to lower your heart rate, so it's more of a parasympathetic response. Now, after you've gone through the medications with your class and helped them to further understand the different categories of autonomic nervous system medications and the different wording that is actually going to further break down the definition and how those drugs respond, you always want to make sure that you're reviewing the 10 rights of medication administration. This is very important, especially for new nurses to understand, because they need to ensure that they're giving the right drug at the right time to the right patient. It's very important, and it helps a lot with safety. So you want to make sure that they ensure the right dose. They need to make sure it's the right medication, that it's the right patient, and they can identify them using the armband and patient name and date of birth. The right route of medication. So they need to make sure they're reviewing their orders, make sure that this is the right way to give this medication, the right time of medication administration, the right documentation of medication administration. So if they've given a medication, they need to ensure documentation is correct so that the next time the patient needs to receive it, it's also at the right time. They need to also understand that the patient has the right to refuse medication, and this should also be documented well in the chart. The right assessment prior to giving a drug and the right evaluation after giving a drug should also occur. You can break the class into groups, and they can actually role play this. And you can further emphasize the importance by showing them a YouTube video that just goes through the 10 rights again and maybe shows them an example of how they can follow through with these, and just emphasize that this is important for patient safety. After that, you should also go through the patient or the nursing process with the students, and that's just ensuring that that's giving them that foundation, ensuring that they know that these are the right steps to take when evaluating their patient, and ensuring that they're doing the right thing for their patient. You can go through the assessment, diagnosing, planning, implementing, and evaluating of giving the medication, and then after they give it, how they should truly evaluate the patient. And this can be further emphasized and shown through giving a case study. You can give an example of a patient, ensure that they're reviewing the patient's allergies, their history, looking at their vital signs, their labs, prior to giving a medication. They also need to look at the different labs, like is this drug being metabolized out by the liver or the renal system? You know, what do my liver and renal labs look like? Is this really appropriate for the patient? Planning to give this medication. Is it the right time? Again, and is this what's best for the patient? After they've given it, through implementation, they need to do always appropriate evaluation of the drug. They need to ensure that this drug was given to their patient appropriately and that it's not causing a poor or wrong response. After you've done the entire class with this group of students, you want to validate their knowledge, and you want to ensure that they've understood all the points in class, and this can be done through giving NCLEX type questions about autonomic nervous system medications. You're going to give them about 60 minutes to take a test, and they need to make a 70 or above, and that's just going to, again, further validate how they understood the information. And you need to make sure that you give them opportunities to ask questions, have further discussion, because you want them to succeed. These NCLEX questions, doing it in that format, can also further prepare them to take their NCLEX once they are finished with school. It'll really help them be prepared for nursing in the real world. So I just want to thank you for listening to this video. If you have any further questions about autonomic nervous system or autonomic nervous system medications, I encourage you to look in some different books, like your pharmacology book, and you can also research more on YouTube or through different sites such as the AACN, just to help further validate the information. Thank you so much.